This is our Session 3 lecture on the elements of dental malpractice. The history of malpractice is kind of interesting. During most of the 19th century, injured patients brought a contract action against their healthcare provider when there was a bad or unexpected outcome. So basically, the patient would argue that the doctor contracted with him or her to cure a specific ailment, and then because the doctor failed to cure the ailment, the patient should get his money back. That's basically a contract. So then things started to shift at the end of the 19th century to actions in tort instead of contract actions. Torts are civil wrongs that unfairly cause someone else to suffer loss or harm resulting in legal liability for the person who commits the tortious act. Basically, a tort is any wrongful act that isn't a breach of contract. So there are many different torts, and negligence is one kind of tort. Negligence is conduct which falls below the standard established by the law for the protection of others against unreasonable risk of harm. This definition comes from the Restatement of Torts, the second edition. The Restatement of Torts is a huge treatise that defines the various different kinds of torts. As I said, there are many different kinds of torts. Malpractice is a type of negligence. Medical and dental malpractice are types of malpractice. Okay, so there are 4 basic elements in a malpractice cause of action. The first element is duty. There is a duty owed to a person or group of people. In a dental malpractice case, the patient has to prove that the defendant dentist owed her a duty of care. She has to show, in other words, that there was a dentist-patient relationship. For example, if you are working for Park Dental, you will not have a duty towards every person who presents to the facility for treatment. You will only have a duty towards your own patients. There is a breach of that duty. That's the second element of malpractice. This is referred to also as a violation of the standard of care. Third, there is a resulting compensable harm. And fourth, the resulting harm was proximately caused by the breach of the duty of care. The plaintiff, who is usually a disgruntled patient, in your case, has to prove all 4 elements to prevail in a malpractice lawsuit. Duty. I'm going to go through the different elements of a malpractice cause of action for you now throughout the rest of the lecture. Duty. A dentist has a duty to use that degree of care and skill which is expected of a reasonably competent dentist acting in the same or similar circumstances. This duty may refer to an obligation to act in a certain way. For example, in a malpractice case, the patient would allege that the dentist had a duty to diagnose her oral cancer and refer her to a specialist for treatment. This duty may also refer to an obligation to refrain from doing something. So, for example, the patient would allege that the dentist had a duty to refrain from dropping instruments or teeth down her throat, from extracting the wrong tooth, or from drilling too far into a tooth. The duty may refer to information given to a patient before acting. So, for example, the patient would allege that the dentist had a duty to discuss the risks and benefits of the procedure. To whom does the dentist owe the duty? The dentist owes the duty to the patient. So in order to bring a lawsuit successfully, a patient has to prove that there was a dentist-patient relationship. Without a dentist-patient relationship, there can be no malpractice liability. An exception to this is a loss of consortium claim. And in a loss of consortium claim, the spouse of the plaintiff can also sue the defendant for loss of companionship, affection, moral support, and sexual relations. But that's an exception, and we'll talk about it later. The dentist-patient relationship in general is entirely consensual between the dentist and the patient. The patient will request that the dentist provide treatment, and the dentist will agree to do so. It's kind of like a contract. It generally starts when the patient entrusts herself to the care of the dentist and when the dentist accepts the case. The existence of a dentist-patient relationship is usually not in contention in a dental malpractice lawsuit. However, problems can arise if casually given dental advice is followed. So, for example, I've seen physicians sued who gave advice to a colleague during a curbside consultation. So in that case, the patient would allege that there was a doctor-patient relationship between her and that third-party doctor who had given her doctor advice. I've also seen healthcare providers sued for giving acquaintances treatment advice. So like if you're at a cocktail party and someone asks you what the rash is on your arm, and you say, oh, it looks like a mosquito bite, but it's really necrotizing fasciitis, the patient may sue you for a misdiagnosis. That's where the dentist-patient relationship can get kind of foggy, because did you really have a relationship as a dentist and patient at a cocktail party? Anyway, that would be up to the jury to decide. So a dentist-patient relationship continues until it is ended by the consent of the parties, by dismissal of the dentist, or until the dentist's services are no longer needed. The dentist-patient relationship is a central issue in patient abandonment claims. Malpractice suits based on abandonment often involve a dentist who ended a treatment relationship when the patient still needed dental care. In Alvarado versus Miles, which was in the required reading, there is a fairly typical abandonment scenario. The patient had a complication of treatment while the dentist was on vacation. His coverage arrangements were inadequate and the patient did not receive appropriate treatment. And in that case, even though the dentist won the lawsuit, it would have been way easier for him if he just had better vacation coverage. Sometimes when you're doing things like getting vacation coverage, you have to consider whether it's worth exposing yourself to the liability risk. So you have to think about the amount of time and trouble it takes to be a defendant in a lawsuit and then to go through an appeal. To be in a lawsuit takes a lot of time away from your practice. So anyway, you don't always have to think about malpractice, but it's worthwhile to keep it in mind. The standard of care. Standard of care is what a reasonable dentist would do under the same or similar circumstances. Again, remember, we're going through the different elements of a malpractice lawsuit. The standard of care requires that the dentist exercise that degree of skill and care that would be expected of the average qualified dentist practicing under like circumstances. This is not a good faith standard, so trying your hardest isn't really relevant. The standard does not require superior practice or excellence. Also keep in mind that the standard of care is fluid. It changes with advances in dental care. So the standard of care tends to go up and up and up and up. And because it's always changing, it's important for you as a dentist to always keep abreast of professional developments, so that you're aware of what options are available to your patients and that you're not undertaking responsibilities that are beyond the scope of your training and skill. If you do adopt new techniques, you have to be reasonably sensible and competent in their use. Even if you don't want to use the new techniques, you may need to advise the patient of that particular treatment option. So for example, you may not do implants, but you should inform a patient who is a candidate for implants that the treatment option exists, and then you should refer to another dentist if requested by the patient. You are not negligent for choosing to use a less popular method or material, for example, dentures. There are lots and lots of different options, and it doesn't mean that because you choose one option that somebody else wouldn't have chosen, that you are negligent. Specialists are held to the standard of care of a specialist. So for example, orthodontists are expected to practice with the expertise of a competent orthodontist, and in a lawsuit, the experts who would be providing testimony on standard of care would be orthodontists. A general dentist is held to a specialist standard of care in some circumstances. For example, if a procedure is attempted and the available or known evidence suggests that it should only have been performed by a specialist, a general dentist is going to be held to a higher standard. If the dentist insists on completing a procedure when complications arise that are best handled by a specialist, there's going to be a specialist standard of care. Also, if the dentist continues a procedure when circumstances would allow the work to be stopped without serious complications to the patient, rather than referring the patient to a specialist to complete it, the general dentist is going to be held to a specialist standard of care. If the dentist holds herself out as having specialist expertise, and if the patient relies on that expertise in choosing care from that dentist is going to be held to the specialist level of expertise that they advertise or holds themselves out to. In Minnesota, there's a duty to refer if the patient's condition is beyond the dentist's ability or skill to treat with reasonable success. I posted the duty to refer jury instruction in Moodle, which was in the required reading for today's lecture. Bad results. Bad results happen. There's a difference between incompetence and an isolated bad result. A bad result without substandard care is not negligence. So for example, if you do everything right, but the patient suffers nerve damage because of her anatomy, it doesn't mean that you have not treated the patient within the standard of care. However, if you fail to use reasonable care to obtain the information that you would need to exercise your professional judgment, that's negligence. The jury uses jury instructions to know what the standard of care is. So what happens is a judge gives the jury instructions to the jury at the end of a trial. So if you look at what's called CIV-JIG 80.10 and 80.13, which are in the required reading, you will see the kind of instructions that are given to the jury. At the end of the trial, in addition to these jury instructions that I've posted in Moodle for you, the jury will also get similar instructions on causation, damages, mitigation of damages, and a number of different other things that the two sides will argue about on whether and which jury instructions the jury should get. So the jury determines what the standard of care is by referring to the jury instructions. A jury of laypersons do not have the training and knowledge to independently determine the appropriate standard of care and whether a particular dentist deviated from it. That's why expert witnesses are used in lawsuits, and that's why the jury uses the jury instructions to apply the testimony by the experts to the law. Causation. Causation is another element of a malpractice lawsuit. So in order to maintain an actionable malpractice claim, the plaintiff must prove that the breach of the standard of care was causally related to an identifiable harm. Experts are also used to prove whether the alleged negligence caused the patient's injuries. I asked you to read Sherman v. Rasmussen for the lecture today. I have the Sherman v. Rasmussen case in the required reading for a couple of reasons. The first is because it has a very good discussion of what it takes to prove that an alleged breach of the duty or care caused the patient's injuries. The other reason is that Nelson Rodas was the plaintiff's expert, and some of you may be familiar with Dr. Rodas and his work, or have seen him in the halls of the School of Dentistry. The big causation issue in Sherman v. Rasmussen is the burden of proof in regard to causation. The burden of proof in malpractice actions is a preponderance of the evidence. That means more than a 50% chance. This is different than in a criminal case where the elements of the crime must be proved beyond a reasonable doubt. So in a malpractice case, each element, duty, breach, causation, and harm, has to be proved by a preponderance of the evidence. In the case of causation, the plaintiff then would have to show that the injury was more probably caused by the dentist's negligence than from something else. In other words, the patient must be able to show that there is a more than 50% probability that the dentist's negligence was the cause of her injury. In Sherman v. Rasmussen, the patient's experts never testified that it was more probable than not that the defendant dentist's alleged negligence, which was doing the injection too fast, was the proximate cause of the patient's injury, which was damage to the lingual nerve, and that's why the case was dismissed. Causation can get very complicated in malpractice cases. There are a number of different causation issues that make what seems like a clear case of negligence actually a winning case for the dentist. For example, there may be a case with underlying conditions, or otherwise known as existing conditions. So let's say a patient presents to you with advanced periodontal disease. You try to save her teeth, but despite your best efforts, you fail to control the disease, and ultimately the patient loses all of her teeth. As your defense lawyer, I am going to argue that no matter what you did, she would have lost her teeth. In other words, your treatment was not the proximate cause of her disease. Her pre-existing periodontal disease was the proximate cause of her disease. Or consider this case. You fail to diagnose a cancerous lesion on the patient's tongue. The cancer spreads, becomes inoperable, and the patient dies. You may have been negligent in failing to diagnose the lesion, but I want to ask as your attorney, what portion of the patient's damages are actually attributable to your failure? As your attorney, I might be able to argue that the cancer was so advanced when you first had an opportunity to diagnose it that the patient's course would have been identical even if you had diagnosed the lesion earlier. Or perhaps the cancer was so aggressive that an earlier diagnosis would not have made a difference. In this lawsuit, your attorney will attempt to determine, with the help of experts of course, how much of the patient's loss of life expectancy can be attributed to your failure to diagnose the cancer. So the breach must be the direct cause of the injury. It is not enough that the patient suffered an injury during a surgery. Negligence alone is also not enough. So then what if more than one dentist contributes to the patient's injuries? For example, let's say your negligence causes the patient's infection, but the patient then goes to the emergency department and is prescribed an antibiotic to which she has a known allergy and she dies. In general, if you and another dentist are both found partially negligent for a patient's injuries, you will be proportionally responsible for damages based on your percentage of fault. However, in Minnesota and other states with joint and several liability, if your fault is greater than 50%, you are responsible for the entire amount of damages. This actually, then you would go after the other dentist to indemnify you for his or her portion. But if one of the negligent defendants is uncollectible, so for example, your emergency physician in the prior case example didn't have any insurance and was bankrupt, the plaintiff can ask the court to reallocate that defendant's share of damages to you. So you would end up paying the entire amount of damages. Contributory negligence means the patient's actions are contributing to his or her injuries. I posted jury instructions about contributory negligence in Moodle for you to take a look at today. In Minnesota, but not all states, a defendant can introduce evidence to show that a patient's own negligence contributed to her injuries. So for example, in the Roman v. Barton case, which was assigned for today, the patient claimed that the dentist's failure to refer him to a specialist for a growth under his tongue was negligent and diminished his life expectancy. The dentist argued that the patient should not have waited to seek further treatment for 5 months as the growth got bigger and more painful. So in a case like that, the patient may get damages. For example, the patient may get $200,000 worth of damages, but his own negligence would decrease that damages amount by the percentage of his own negligence. Okay? So, harm and damages. Even if there's a breach of the standard of care, and even if there seems to be approximate cause to something that happened, there can be no liability if the patient has suffered no compensable harm. Okay? A no damages scenario is fairly common in malpractice cases. For example, if a dentist does everything wrong, the hygienist, office staff aren't helpful or are rude, and the patient is insulted and angry, and she initially has a little bit of nerve damage, then she's lost a little feeling in her lower lip, and we know that it was negligent, but then she completely recovers feeling in her lip. There are really no damages. I mean, maybe her feelings are hurt, maybe this was a little embarrassing to her, maybe she hates her receptionist, but there are no damages, so there is no case. But let's say that there is a case. For example, a dentist's negligence resulted in infection that was the proximate cause of the patient's bone loss, which resulted in the patient losing her teeth. When a patient files a lawsuit against the dentist, part of the motivation might be to get you to admit that you have done something wrong, but a large part of why a patient brings a lawsuit is to get the damages or to get the money. Compensatory damages are damages that are intended to compensate the plaintiff for the actual harm that they've suffered. Various kind of compensatory damages listed up here are out-of-pocket losses. Those would be medical bills, future medical bills, loss of earnings. So if the person missed work because of the injury, loss of earning potential. In the required reading today, there's a case about a singer who alleged that his partial bridge ruined his ability to sing. Another example would be a model or a celebrity or someone who makes money off of their looks who has a bad whitening result. They would make a claim for loss of earning potential because of their adverse reaction. Okay, so the value of a person's pain and suffering is also compensatory damages, and that's something that the jury has to kind of work up based on other cases. So the plaintiff's attorney and the defense attorney will argue about what a fair amount is for pain and suffering, and then they'll come they'll present that to the jury, and the jury will come up with a fair number. There's new law in Minnesota, the loss of chance damages in a wrongful death case. This wasn't law before last year, and this new law allows patients to recover for their chance or survival. The Minnesota Supreme Court case has just established this, and this is in the recommended reading, but not in the required reading for today. The case name is Dickoff versus Green. It is a childhood cancer case, but the same argument could be made in the Roman v. Barton case, which is the tongue cancer case involving a dentist. That was in the required reading for today. So up on the slide is the formula for calculating loss of chance damages in a wrongful death case. So for a case in which the plaintiff has not died, the appropriate measure of damages is the value of the reduction of the plaintiff's life expectancy from her pre-negligence life expectancy. And the jury has to determine the amount of damages necessary to compensate the patient for that reduction in life expectancy. Punitive damages are supposed to punish the defendant. They're more like a fine and are awarded in addition to compensatory damages. Punitive damages are fairly rare in malpractice cases and are only awarded where the defendant's actions are egregious or deliberate and intentional. There's usually something more than negligence going on. So for example, in the Tulliver v. Gamble case, which was in the required reading, there was evidence of the dentist concealing his negligence and trying to convince the patient that the bad result was normal. You also see punitive damages in cases where dentists do things like sexually assault patients who are under anesthesia, who fail to obtain consent, or who let dental technicians practice dentistry, a case that was also in the recommended reading for today. Most dental liability policies, your malpractice insurance policy, will not cover punitive damages. So if you look in the list of exclusions in a dental liability policy agreement, you will probably see the exclusion for punitive damages. And that's kind of a big deal because punitive damages can be in the millions of dollars, and that's a lot of money coming out of your own pocket. Vicarious liability. Vicarious liability has been around for a long time, and that's kind of indicative in this little quote, vicarious liability, let the master answer for the torts of his servant. That means that the principal is responsible for the acts, the negligent acts of his or her subordinate agent or partner. Respondeat superior is another way to describe vicarious liability. So under respondeat superior, you are responsible for the negligent acts of your employees occurring within the scope of employment, even if you have done nothing wrong. In cases like this, the plaintiff will sue the employer and the employee jointly, but the plaintiff is actually only entitled to one recovery, so one set of damages. Examples where this arises in dentistry include an employer dentist being liable for the acts of her employee hygienist, dental assistant, dental tech, etc. Also, dentists and partnerships are liable for each other's negligent acts. So you can be vicariously liable for the negligence of your partner in a partnership. In an employment scenario where a hygienist drops a polishing tool down a patient's throat, a vicarious liability action would look something like this. The patient files a lawsuit against both the dentist, as the employer, and the hygienist, who had the direct duty towards the patient. Then the dentist would have a right to bring an action against the hygienist to recover any damages that the dentist had to pay to the patient. In reality, this is an insurance issue. So ultimately, the professional liability carrier pays the money. You don't pay the money. And if the dentist and hygienist have different insurers, the dentist insurers go after the hygienist insurers for any money that they had to pay out. So to avoid conflict in the defense of a claim, it's often recommended to have everybody in the office insured by one person, or by one insurer, Statute of limitations. Statute of limitations can be a very, very strong defense for defendants. The statute of limitations specifies the period of time allowed for an individual to file a claim against another party. Different types of cases have different statutes of limitations. So for example, a dental malpractice case has a different statute of limitations than a contract case. So today you were to read the Doyle v. Kutch case. It has a very good explanation of the standard of the statute of limitations and how it works. There is some discussion in that case of the cause of action accruing. When the cause of action accrues basically means when the clock starts ticking towards the end of the statute of limitations. So in a state with a 4-year statute of limitations for malpractice actions, the patient has 4 years from the time that the cause of action accrues to file their lawsuit. In the case that you read, Doyle v. Kutch, it was decided when the dental malpractice statute of limitations was 2 years. But in Minnesota, the statute of limitations for professional liability claims is now 4 years from the date that the cause accrued. Don't get too confused there. We're talking about a 4-year statute of limitations for any kind of healthcare malpractice case in the state of Minnesota. For minors, there are different statutes of limitations for different kinds of plaintiffs. So for example, if the plaintiff is a minor, the lawsuit has to be filed within 1 year of the minor's 18th birthday, but not more than 7 years after the date of the injury. So basically, the statute of limitations stops running until the 18th birthday. Okay, so the Doyle v. Kutch case has this argument in it about when the cause of action is accruing. In most malpractice cases, the general termination of treatment rule applies. So the cause of action accrues when the dentist's or physician's treatment for a particular condition ends. However, in rare circumstances, the single act exception applies, and the cause of action starts to accrue when the patient is injured. The single act exception applies when a malpractice claim is based on a single act of alleged negligent conduct rather than a course of treatment. So the defendant dentist in the Doyle v. Kutch case argued that the statute of limitations should have started to run at the time he extracted the patient's tooth, not the last time she presented to his office, which was presumably for follow-up or something. If the single act exception applied, then the patient would have filed her lawsuit after the statute of limitations expired, and the case against the dentist would have been dismissed. However, as the court said in Doyle, in most dental cases, the general termination of treatment rule will apply. And, quote, there is a practical reason why the single act exception is an exception. Actionable treatment does not ordinarily consist of a single act, or even if it does, it is most difficult to determine the precise time of its occurrence, end of quote. So the single act exception is very, very rare and kind of difficult to pick out of a factual pattern. So you can really think of the cause of action occurring when your treatment of the patient ends. If you hear something about the tolling, T-O-L-L-I-N-G, of the statute of limitations, it's referring to an event that freezes the running of the statute of limitations. So the statute is tolled while a patient is a minor, and then it starts running again at the child's 18th birthday. And that is all I have for today. Please do the required reading for the next session.